Now for our next conversation, I would like to invite to the stage Katie Dane, CEO of the NCD Alliance, Luchika Ditu, Executive Director of the Stop TB Partnership, and Erica Satterwhite, Head of Global Policy for Viatris. This is for a conversation on mobilizing for universal health access to medicines. Thank you for joining us, and welcome. So I'd like to dive a little bit deeper into the issue relating to access to medicines, flowing from the conversation that we were just having specifically about financing. 8 billion people around the world don't have access to medicines presently. And that is from a range of issues, from supply, logistics, last mile delivery, and there are a number of complex challenges that need to be addressed in order to really get those medicines to where they need to go to drive that impact. So, Erica, I'd like to start with you. I know this is an issue that you've been working on for many years and is, central to your role. And so when you think about this issue, what are some of the major barriers that you're seeing right now as it relates to access to medicine?
Yeah, thanks so much for that. So access, as you said, is still something that we continue to strive for, I think, collectively. It's an agreed target that we all collectively are working towards as part of the SDGs, and we know we're not entirely on track. We know that there are people who still absolutely need access today. There are a lot of barriers, and I think part of the challenge that we face here is that there's no one-size-fits-all. The needs of different people, the needs of different communities will be different. And I think one of the terrific parts is that today we have a panel focusing both on NCDs and infectious disease, the biggest infectious disease killer, tuberculosis. And I'm really thrilled that we have this opportunity to discuss, because people aren't impacted by just one or the other. People face health conditions across the span, with acute, with chronic, with infectious, with non-communicable, and how we look at the systems, how we look at our ability to sustainably enable that access. There are so many different challenges. I think there's a lot of learnings that we have when it comes to what worked, what didn't work in COVID.
Thank you. I hope that's better. Wonderful. Thank you so much. So I think part of when we're talking about the barriers to access to medicine, maybe starting with some of the learnings that we had from COVID and what can work differently as we move forward based on that experience is a good way to sum up where we see some of those key buckets of barriers. One of the things that became really clear was, as you said, around global supply chain. We need that interconnected global supply chain in order to enable us to reach people where they are with the medicines that they need when they need it. What also became very clear as a result of COVID, and a remaining barrier that we see, is around regulatory efficiency really matters, because there's a lot of back-end work that has to happen to make medicines available wherever they need to be. And there's a lot of improvements that we can make together in order to better enable that. We also need to really focus on what it means to have sustained availability. It doesn't matter if you have a medicine now, if you can't get it tomorrow, if you can't get it the next day, because it's no longer viable to have that. So there's a lot of sort of back end, speaking from a company that works on supplying medicines around the world. Last year, we supplied approximately 1 billion patients around the world with medicines across many different therapy areas: acute, chronic, infectious, non-communicable. It takes a lot. It takes a lot to even make that medicine available, and that doesn't even get into the next step. Once the medicine's available, how do we make it accessible? How do we make sure we're listening to the needs of people, of the needs of communities, building the right systems to enable that?
Thank you for that, and I agree. We're honored to have such diverse perspectives and complementary perspectives on this panel. And so, with respect to TB, Luchika, I'd like to turn to you. And
I need this, or I need this? No, I need this. Okay.
That's a little bit better. That's a little bit better. Thank you. And understanding as well, as part of the high-level meetings, there's a big focus on TB right now. What are you seeing in terms of the landscape, and what needs to be done, what can be done this week to really address the urgency with TB and how we can ensure, as Erica was mentioning, that we're able to get the medicines, the treatments to those people in need as efficiently as possible.
Thank you so much for the question, and really thank you for inviting me here. I come from the TB community, and I'm very happy to see that I can probably know just 4 or 5 faces in the room, which is great. I will keep saying that because for tuberculosis, this is great because usually we speak to the same audiences and we cry among each other, with no outcome, okay? If you tell you preach to the converted, it's like, awesome, but nothing happens. So I'm really happy that I am here with all of you. First of all, because you're absolutely right, TB is a big drama. Very few people know TB is an airborne pandemic, okay? You can eat very healthy, you can run every day, you can use condoms, you can avoid that and this and that, sleep under a bed net. You breathe. And the moment you breathe, you can breathe in as well Mycobacterium tuberculosis, okay? Very few people know about that or acknowledge that or understand that. And even worse, and you spoke about this week, very few people come to acknowledge. You see, we have today is the PPPR meeting, okay, about pandemic preparedness response. You see, COVID was an airborne pandemic. When COVID happened, everybody ran like crazy to the TB doctors because we know to deal to the lungs. The hospitals and the laboratories have these infection control measures where they are. So they were the frontliners. Now, COVID passed, TB go back in the shadow, and in the PPPR declaration, the word TB didn't come at all, or it comes associated with an enumeration of other diseases. So you said what we do, I can speak about many things related to what you said, because you see, and linked to what you said before and what Erica said about access. The drama we have in TB is that people that are the most vulnerable are the ones that have obviously the least access to drugs, but also to diagnostics. We estimate 10 million people with TB every year. We are able to diagnose, according to WHO, 6 to 7 million. 3 million people are somewhere out there in this world. And not only that they suffer themselves, but because it's airborne, they infect others. So ensuring access to these people as easy as possible to diagnosis and treatment and care is essential for TB. But it's very difficult because those people are not like us. Even us, we are kind of delaying to go to the doctor. We are not very comfortable. So access is crucial. How do you make it easier for them? And we in Stop TB Partnership, we try to reimagining the way that we provide TB care by trying to bring diagnosis and treatments closer to the people. Using digital technology, artificial intelligence, any smart ideas and innovations to make all the barriers that are between a human being and the diagnosis and the treatment are being removed. So you said, and I will stop because you need to also stop me because I can go cuckoo. Because I found you all here, you know, I feel I locked the door and at least we have a group of people. At the end, they know, oh my God, if I cough, it might be TB. It starts with just that. But what can happen after that, you see a lot of people this week, even now we speak and we feel energized. Tomorrow we forget, we move to something else, is what happens when we leave. And the problem is that because I will tell something politically incorrect, but I am famous for being politically incorrect. You see, I heard that for the TB meeting that is Friday, there is no head of state or prime minister from a high-income country. Because it's not our problem. It's the problem of the poor. So what matters is what's happening afterwards. And even if there are the high-burden countries' representatives themselves need to raise their voice and indeed come together and respect all these commitments that are made in this political declaration. And what we do from Stop TB, in addition to doing all this work on innovations and what we said, and we work close to Erica, and I hope we will work close with our friends from the NCDs, and I will make another point, is we work and empower the civil society and communities to be the ones to hold accountable their governments for what they promised. Everyone says, let's create an accountability system at the international level. Nobody will keep a president accountable better than their citizens if it's done properly, because they need the votes every 4 or 5 years, so they will better listen. listen. The last thing I want to say, because I might not be able to speak again, is this. It's very nice you invited the three of us here, because the future, you see, I come here and say we need money for TB, right? HIV needs money, malaria, all the NCDs and so on. We need to be smart and invest in tools that can help the diseases across. Just to give you an example, we have digital portable X-ray now, and the result of the X-ray is read by the computer. It's fantastic. You have a portable thing, and it detects not just TB, but everything in the lungs, including cancer. So we can be smart, and we can benefit all of us on this. So I'll stop here before you.
Very well put. You raised so many very important issues, one of which was diagnostics. We'll be diving into that later today in greater depth. But on that note, I'd like to turn to you, Katie. It is clear that we need to have much greater focus on diagnosing, NCDs, TB, infectious disease earlier. And over the course of the pandemic, we saw how resources can be mobilized to that end. And so when you think about NCDs, what are some of the priorities in your mind and areas of focus that, we all need to be thinking about and discussing to ensure that NCDs are top of mind and they can be diagnosed to then enable greater access to medicine?
Thanks very much. And it's always hard to get a word in when you're next to Luchika on these panels, I'd say. I mean, just to build on what Luchika was saying at the end there, I think first and foremost, we're all here for these 3 high-level meetings in quick succession: pandemics, TB, UHC. NCDs are obviously important to all of them, just as TB is. I think we're beginning to see the, real beginnings of the global health community working better together in an integrated, holistic fashion. I think if I look back to the 2019 UHC high-level meeting, things were very different. It was almost like we were all beginning to get to know each other. And now things are different. But I think, one of the main challenges, particularly from an NCD perspective, is essentially financing, which you were just talking about on the previous panel. Within the NCD space, we're still grappling with the fact that less than 1% of official development assistance for health goes to non-communicable diseases. What an absolute mismatch. NCDs are the #1 killer worldwide and are impacting low middle income countries the most, the hardest, people at a younger age. And the only way that we're really going to be resolving the financing issue is actually by making the pie that we already have go a bit further, right? In terms of actually integrating NCDs, TB, HIV/AIDS, women and children's health, and actually focusing on the primary healthcare level, where you can actually have, one-stop shops that are actually responding to people as a whole, rather than HIV over there, TB over there, cardiovascular disease and diabetes over there. So the financing piece is really difficult. I think in NCDs, in terms of the access challenges, within UHC particularly, in terms of what we need to see from a health system, is first and foremost investment in the primary healthcare level. Primary healthcare level is one of the most neglected parts of the system, and yet we know whether it comes to cardiovascular disease or diabetes, it's that community level that you can actually really reach people where they are. You can actually be detecting them early to avoid complications, hospitalization, advanced stages, which are so much more crippling, obviously to the people, but also to economies, because it's essentially kidney diseases resulting in dialysis and transplant, which is completely and utterly out of reach for so many people. And what is required in so many low middle income countries to actually achieve that is essentially a bit of a reorientation of the whole system to be more of a focus on chronic care. Because what we're seeing over, from an epidemiological perspective is huge advancements in things like HIV/AIDS. And so essentially they are now chronic conditions themselves. And so we need to be changing the system to actually be more proactive around early detection and treatment, around health promotion and prevention. How much have we actually heard this week about prevention? We know in NCDs that if you actually act early, if you focus on the common risk factors, smoking, unhealthy diets, physical activity, have a huge impact on actually reducing the burden. So, one of our messages within the UHC high-level meeting is you can't just focus on the health system. Governments have to focus on the prevention side as well. Sorry, I'll stop there.
No, not at all. Thank you. And incredible points. And just on that point on prevention, our team at FP Analytics did some research specifically to that end, really looking at the impact of investing early on NCD prevention and how that can have cascading impacts. And when we're talking about efficiency of resource utilization, efficiency of capital, and in a resource-constrained environment, investing upstream to address these issues, particularly in primary care, is incredibly important. And you also mentioned the opportunity this week and how, a few years ago, you were all just getting to know each other. It brings me to partnerships. And this also is an opportunity to get to know each other better, and also ways that the work that you're doing is complementary and can be so aligned. And so when we're thinking about that, Erica, I'd like to turn to you. Can you provide, some insight into how the private sector is playing a role, but also how the role of the private sector is really complementary to other organizations who are very keenly focused on access to medicine?
Yeah, thank you so much. I'm very passionate about partnerships. So this is terrific. And I'm passionate about it because it's not a nice to have. We can't get where we need to be unless we choose to work together and we choose to understand the different perspectives and the fact that it is the varied experiences and expertise that we need to have together in order to move us forward. It's not a nice to have. We need to partner because no single company, no single organization, no single country can do this alone. We cannot achieve access to medicines for 8 billion people working separately. And we can do so much more together, right? A company like Viatris, access is at the core of what we do. It's the center of our mission to empower people worldwide to live healthier at every stage of life. And it is everything. It is not just something that we say is an initiative, right? Access is not something separate. It is our business model. It is how we achieve our own impact. But we know that that is not something that we do alone. We are part of this ecosystem, and our core competencies in making medicine, in getting them to where they need to be, in developing medicine, in providing more scale to the entire endeavor, that can't happen in a vacuum. We need to work with partners. We need to work with civil society. We need to work with governments. We need to work with stakeholders throughout the ecosystem because each has their core competency. And any single core competency cannot win the day. We need to work together in order to do that. And so I am very hopeful that we are at a time where that is realized, where that is recognized, where we know that the challenges that face us, where we stand today versus the Sustainable Development Goals, and knowing that there is so far to go in the 7 years ahead of us, I'm hoping that, again, we can learn from the experiences of COVID, in which there was some breaking down of those barriers and willingness to partner because of the urgency. That urgency is not gone just because COVID itself has become normal. That urgency remains. And so if anything, I am more optimistic now that because of the urgency of that situation, we can carry that forward and realize there's so much more that we can gain by working together.
Absolutely. And I'd like to pose a question as a follow-up to you, but also for all of you to think about is what's working? Can you provide an example of some of those partnerships that are breaking through, are having an impact that may be unconventional or maybe innovative, but what's working and what can be looked to as a lesson learned and potentially either modeled or, adapted for other environments? If each of you could think about that, I think to the extent that we can ground this also in concrete examples that others can take away and hopefully follow up with you on to also collaborate, I think that would be really helpful.
So I'm happy to start. And the example I'll give was already used on the panel before, but I think it's a great symbol, right, is the Global Fund to fight AIDS, TB, malaria, where private sector is actually on the board. There's actual a seat for private sector in which, full disclosure, I sit in. So I know firsthand that having that space for private sector to sit at the table alongside civil society, alongside governments, alongside technical partners like Luchika, that is really powerful to be able to have spaces in which we can all collaborate on an equal and respectful playing field aligned to the same goal. And so not to say that the Global Fund should be something different or should be something more, not getting into any of that, right? But just saying that spirit of partnership entrenched in the foundation of an organization, I think is so powerful to be able to move us forward from a common place of understanding.
And Luchika, from a technical perspective, what's working, from where you sit, but also, what isn't and what needs to change?
That's a very good question, but we need at least 120 minutes more. It's so much to say about the idea of the partnerships, and I also want to give to say 2-3 examples. I mean, like just enumeration, but in terms of what works, and we are not very good at that. Okay, let's be very honest, because the problem is in a real partnership, every partners should do what is their own comparative advantage, right? You create a partnership and everyone brings at the table what they do the best. What we observe actually is a lot of overlap, and everybody is trying to make their own space and entering in the space of the other one. And you have people that are supposed to do data collection, that are doing community engagement, and you have people that are supposed to do guidelines, that are doing advocacy and financing, rather than saying financing is this. So you are a genuine partnership, bring everything around the table with everybody that does the best that they know. And very important are 2 groups of partners there, and in the Stop TB, which are also, we have a seat at the board of the Global Fund, but we have our own board with a private sector constituency, and I see a few colleagues here with us. Is very important and very genuine, the relationship with a need for a very genuine relationship with the private sector, the industry, but as well private sector providers, as well as the civil society and communities. Traditionally, the civil society and communities, at least in us in TB, were to bring the TB survivors to tell their story and make the audience cry. Okay, that was the idea initially, right? You tick a box, do you have a civil society? Yes. Why? He tells the story. No, they are really the ones that should be at the center. And if properly empowered and properly, equipped with information and knowledge, they will drive the answer. If you want to penetrate at the ground level without civil society and communities, forget about it, okay? And they can come from different levels. So this should be genuine. But it's not, because there is a lot public sector with private sector. People run after me that I'm too close to private sector. I don't even have friends in private sector. But there is this idea, because I speak about the fact that we need to embrace the private sector, not only because of the money, but also of the know-how and everything that is brought at the table. But I want to say that it works. In Stop TB, we have 2 groups that provide funding to try innovative things. It's called TB Reach, which was initially funded by Canada. Now other donors are coming. And another one is Challenge Facility for Civil Society that is giving grants to grassroots organizations. And what these people do is amazing. We are funding early case finding in Pakistan for transgender people. Like people that otherwise will be terrified to go to get diagnosed, big vulnerability. We are, Pakistan as well we are funding a structure called Stop TB Partnership there. They are doing an engagement with the pharmacists in pharmacies in which they are part of the entire chain of diagnosis and follow-up of the treatment, because they are very close around the corner. In Nigeria, for the indigenous population as well, you are able to go to their own communities by their own people and working together with the private sector providers, because in Nigeria, the first place to go, everybody is the doctor around the corner or the nurse around the corner that has a little private business. So there are models that work if you want to know in TB, but they can be actually applied to everything. And I know that we will speak with Kate for NCDs. We have a lot of these examples, because every year we do 30, 40 type of funding in this way. Just to make you all smile, many years ago, we did a project in Lesotho, and we spoke with the Minister of Health, what kind of engagement, and she said, everybody's constructing laboratories for us. Nobody is really interested how people reach the laboratories. So she said, can you buy us some donkeys? And we were at that time, we are a UN organization hosted by them, but we were in WHO at that time. So you can imagine the accountants in WHO when we bought 200 donkeys in Lesotho. And it happened and it worked. And afterwards, Global Fund continued. And now the donkeys are bought by the Lesotho government. So thank you.
that is not the example that I was expecting, but I asked for concrete examples, and you certainly gave us one, so thank you for that. And so, Katie, I'd like to turn to you to close. I mean, you are leading the NCD Alliance, and so when we're talking about partnerships, what are your examples that you can shed light on? What is working, and also what needs to happen to really move the dial and galvanize those who are here this week toward greater action?
I think building on Luchika, I think the first thing to say about public-private partnerships for NCDs is that, within public-private partnerships, you need to be focusing on people, right? And actually the needs of people. And so often I think PPPs are set up without even thinking about what actually the beneficiaries, the people that we're trying to reach, actually most need. So I think that's the kind of the first point to make. The second one is, in so many countries that we support and that we work with, there are so many different initiatives happening basically on similar things. And very few of them are actually kind of making sure that the government priorities are actually the kind of North Star of what the partnerships are focused on. Every country in the world pretty much has a national NCD plan, and the partnerships that are happening in countries should actually be supporting that. And so often it's actually not happening. So really making sure that people are at the centre, government priorities are driving PPPs. And then the third thing I would say, which I think many PPPs over the years have kind of given short shrift on, is really focusing on monitoring and evaluation. At the end of the day, unless you're actually monitoring and evaluating the results that you're having in terms of whether it's NTD prevention or care, the impact that you're having, whether you need to course correct and change direction, whether, you're making progress faster than you can, for example, there's no point, So data collection, monitoring and evaluation is absolutely key, and I think sometimes forgotten in PPPs, essentially.
Absolutely. And when we're talking about a resource-constrained environment, ensuring that those interventions are data-driven, evidence-based to the extent that they can be. And when that data doesn't exist, are there technologies that can be leveraged? Is there, intel, knowledge that can be leveraged from other partners? And also, as you all very importantly put, those from the local communities, because at the end of the day, Katie, as you said, this is about people. So thank you for that. And thank you all for participating today and for the work you're doing. We appreciate it. Thank you.